السلام عليكم، أنا جود القوفي، واليوم إن شاء الله بشرح لكم Anatomy وال History and Physical Examination حق ال Ophthalmology. طبعا الدكتور ما مشي على السلايدات so we're gonna cover everything وبنبهكم على الأشياء اللي ذكرها وقال عليها مهمة. طيب نبدأ with a bit of a review of the eye anatomy. The three coats ممكن تقروها لكن بنركز هنا على chambers. عندنا the anterior chamber is going to be from the cornea to the iris وبعدين the posterior chamber is from the iris to the lens. طبعا all of this, the anterior and the posterior chamber is referred to as the anterior segment. ففرق بين segments chambers. برضو we have the vitreous cavity which makes up the posterior segment. نجي للlacrimal system. يمكن هذه الصورة أوضح. First, we start with the puncti, which are like two openings, and then they lead to two of the ampullas. وبعدين, at the end, we have the two canaliculi, which are these horizontal structures كده طالعة. وبعدين we have a valve called the valve of Rosenmiller. طيب بعدها يصير عندنا lacrimal sac. وبعدها a nasolacrimal duct, which as we know is going to open into the inferior nasal meatus. It's going to end with the valve of Hasner. ليش يهمنا the valve of Hasner? It's the most common site of congenital nasolacrimal duct obstruction وبرضو what both valves have in common اللي هي ال Rosenmiller and the valve of Hasner إيش فكرتها؟ They prevent the reflex of tears. فلما عندنا a defect within these valves ممكن لا سمح الله when someone is blowing their nose you'll hear ringing sounds or like wheezing sounds from the eye or there might be vibration or entrance of air into the cavity. طيب نيجي للtear film. The function is to wash away the debris or dilute irritants, or it smoothens the optical surface, or it's antimicrobial, or it provides oxygenation to the cornea. فكيف شكله؟ كده صار زي ثلاثة طبقات. Okay? Each layer you need to know what it's produced by and you need to know its function. فبالنسبة للlayers, the first layer is the outer layer, the lipid layer. إيش فكرته؟ It protects everything that's inside. The function here you reduce the evaporation of natural tears. فممكن we can have the mucin layer and the aqueous layer intact لكن if we have an issue with the lipid layer we're not gonna يعني ما راح نستفيد من اللي قاعد ينفرز in these two layers. It's going to be produced by the meibomian glands وبعدين نجي للaqueous layer. This is the antimicrobial layer. It's produced by the lacrimal glands اللي هي هذه وبعدين عندنا the mucin is produced by the goblet cells this is what keeps the eye lubricated. طبعا إذا شفتوا بالslit lamp you can see the meibomian glands كده مسوية. المهم and then we also have two types of tear secretion. أول شيء الدكتور قال هذا المهم it can be an MCQ. عندنا basic tear secretion which is يعني اللي دائما ينفرز من العين regardless of the stimuli دائما يكون عندنا هذا basic tear secretion. It's secreted by the conjunctival glands اللي هي this is FYI it's called Krauss and Wolfram glands. عندنا برضو the reflex secretion. هذا يصير لما مثلا you have an irritant in your eye فمثلا بتقطع بصل or there's like smoke in the air or something. المهم this is going to be what's secreted by the lacrimal glands. ففرقوا the lacrimal glands don't produce the basic tears that we always have. They produce reflex tears. والدكتور also mentioned epiphora and this is when you have watery eyes. This is because of an imbalance between the production and the drainage. نيجي للeyelids. The function is to protect the blinking reflex to secrete tears. عندنا three main muscles. Okay, عندنا orbicularis oculi هذه نعرفها. It's innervated by the facial nerve with sensation is going to be by the ophthalmic nerve, the division of the trigeminal nerve. The function is to close the eyelids. Orbicularis oculi closes the eyelids. When you want to open your eyelids, we're going to use the levator muscle. This is going to be supplied by the third cranial nerve, which is why in third cranial nerve pulse you might have ptosis. You will have ptosis. بعدها we have Muller's muscle. This is a smaller muscle. طيب. It's innervated by the sympathetic nerves. فإيش يصير if we have Horner syndrome? Horner syndrome, you have an issue with the sympathetic nerves. You have mild ptosis. ليش؟ لأنه the levator muscle isn't paralyzed, but the molar muscle is affected. So you have some type of partial ptosis. بوريكم صورة بعدين. هذا this is review. The cornea قلنا it's avascular but it's highly innervated. هذه يحبوا يسألوا فيها. It's the most innervated structure in the body سبحان الله. فأي خدش في القرنية لا سمح الله يعني you'll see the patient in excruciating pain. المهم steep cornea can cause myopia by increasing refractive power. هذا الدكتور he mentioned it. وبرضه the functions is to protect the eye. It's transparent and it consists of 5 layers. وبرضه it accounts for most of the refractive power of the eye. وقلنا it's richly innervated by the trigeminal nerve specifically. وعندنا the layers we have the subepithelium or the stroma وكل الكلام ده. Okay, السclera, this is the white part that you see. إيش فكرته? It's opaque and it's where all the muscles are going to attach to the eye. وهنا is perforated by the optic nerve زي ما انتم شايفين. Okay, the iris, it's the colored part of the eye. هنا اللي يهمنا the two muscles. عندنا the dilating muscle is controlled by sympathetic nerves والsphincter, the constricting muscles اللي هو sphincter is controlled by the parasympathetic nerves. when we have Horner syndrome, ليش يكون عندنا meiosis, a constricting pupil? قلنا Horner syndrome affects the sympathetic. فهنا when you don't have the dilating muscle, the sphincter or the constricting muscle is going to take over, so you're going to have a constricted pupil. برضه ptosis قلنا بسبة إنه Muller's muscle is going to be it's not going to work. وعندنا anhidrosis because uh, sweat glands are modified sympathetic glands. طيب, this is repetition. هذه مصطلحات الدكتور قال اقروها بس يعني مهمة بس they don't need any explanation. طيب, a ciliary body, what he mentioned was that accommodation decreases with age. Well, this is like a chart that they use. Okay, initiated lens. It's a transparent body. It's covered by a capsule. It consists of proteins and water. وهذا حيهمنا في cataracts, which we're going to talk about in the next lecture. It also has some type of accommodative power. It's not a lot زي الكورنيا لكن it helps in accommodation. وليش الأطفال مثلا they have better accommodation? Because the lens is more elastic. So it can move more easily and they're able to accommodate very quickly. هذا مكرر. الcord زي ما قلنا it's for nourishment and heat exchange and it has the blood vessels. The retina is the neural layer. وعندنا the photoreceptor cells اللي هي الcones والrods. You can read this. طيب, الfovea is the depression in the retina that has only cones, which is why it's the central and sharpest vision. نيجي للoptic nerve. The optic nerve consists of the axons. It's our blind spot because there are no rods or cones in it. هذا ما شرح الدكتور, but this is the visual pathway of how the light reaches the brain and is interpreted. طيب, نيجي للextraocular muscles. هذه مراجعة شوية. So we have 6 muscles. إذا تذكروا this mnemonic, the superior oblique is innervated by the trochlear nerve, the lateral rectus by the abducens nerve, and the rest is going to be by the oculomotor nerve. هنا كاتبين لكم كل الفانكشنز لو تبوا تراجعوها. This is another image. وهذه برضو نفس الفكرة إنه كيف light is interpreted. طيب, نجي للhistory. So أول شيء, the history in ophthalmology is going to be very focused لأنه أصلا the main complaints are very limited. It's not يعني a wide range. We're going to start with the age and the gender and the occupation. الدكتور قال شيء مهم. If you could ask one question for patients who are يعني of older age, it would be if they're diabetic. So you could keep that in mind if مثلا you get an older patient. You're going to take a history of the complaint. أغلب complaints, what are they going to be? Red eye pain, if they have some type of sudden or gradual vision loss, diplopia اللي هو double vision. عندكم squint floaters and flashes proptosis. طيب, this is what we mean by squint. It's also called strabismus. This is diplopia. This is proptosis. Usually you'll see it in graves, but this is another example of the diplopia. These are floaters, these are flashing lights. So you want to ask about all these different things and يعني how they appeared with the patient or how long they've been يعني how long they've had it. But then you're going to get to the past ocular history. So you're going to ask about refractive errors. Are they hyperopes? Are they myopes, etc.? برضه if they had any inflammation, trauma. So you're going to ask about the known ophthalmic conditions, specifically about amblyopia. And then you're also going to check whether or not the patient wears glasses or contact lenses normally, or you're going to ask when's the last time they checked it, and if they had any previous eye surgery. وبعدين you're going to come to the family history. You're going to ask about cataracts, primary open angle glaucoma, or any eye disease or systemic diseases like diabetes. فهنا there's specific diseases that they usually like to ask about اللي هي diabetes والhypertension والthyroid diseases. وبعدين طبعا بتسألوا عن past medical history والmedications والallergies. drugs برضو you can ask about corticosteroids because they can be one of the causative agents of glaucoma and cataracts. وبرضو other يعني medications يعني مو غير إنه the medications that a patient is taking could cause a problem with the eyes. The medication that they're taking because of his يعني to treat an ocular cause can cause يعني they can aggravate systemic conditions. So you want to keep that in mind that مثلا they're taking some type of eye drops that have beta blockers. This can affect as نيجي للphysical examination. أهم شيء is going to be the visual acuity. بعدين we're going to examine the patient's pupils and we're going to examine the external eye as well as the anterior segment using the slit lamp. And then we're going to measure the intraocular pressure. هذا يهمنا في الجلاكوما اللي هو المحاضرة الجاية. بعدين we're going to use the fundoscope to visualize the retina and measure the patient's visual fields. بالنسبة للvisual acuity هذا الكلام أوضح, it's the same thing. المهم, visual acuity is how we test the macula's function and the optic nerve as well. We're basically measuring your visual resolution. فالفكرة هنا we're measuring how well can the eye distinguish between 2 points. مثلا هنا we have 2 dots. يعني أتمنى إن you guys can see them as 2 separate dots. لكن هنا you can see them as 2 separate dots. And when I zoom out, they look like one. نفس الanalogy with the thumb. Let's say I hold my thumb really close to my face, it looks big, right? As soon as I extend my hand, it looks smaller. فعشان كذا ما بنقدر نعتمد على مثلا standard measurements such as centimeters or meters لأنه it's not going to reflect how well the patient is seeing. فالفكرة هنا اخترعوا something called the minutes of arc. ما له علاقة بالوقت. It's essentially an angle. فالفكرة هنا إنه with this chart هم مسوينها بطريقة معينة بحيث إنه you can measure how well your eye can distinguish between 2 points. فمثلا the letter E over here is 5 minutes of arc. Each line in each space is 1 minute of arc. يعني مثلا 1 2 3 4 5. If you can resolve if you can resolve the differences between it and you can see it clearly, that means that you have 20/20 vision. إيش معناتها؟ معناتها what a normal person sees at 20 feet, I believe, 8 feet, at 20 feet, you can also resolve it and see it in the same way normally. هذه الفكرة هنا. بالنسبة للpupil, you want to check for 3 things. RRR. Is it round? Is it regular? And is it reactive? If it's irregular, ممكن يكون بسبب synechia. And this is when the iris will be stuck to the lens فبيسحب وكذا and the shape is going to become irregular زي ما انتم شايفين كذا. Also, angle closure glaucoma, trauma, iritis, surgery, وأحيانا كذا بدون سبب. بالنسبة للpupillary response, we're going to check, أول شيء we're going to make sure that the patient is fixating their eyes on something far away because we want to make sure that they aren't accommodating so we can properly observe the pupils. And we want to be in dim lighting. But we're going to inspect 3 things: the direct reflex, the indirect reflex, and the swinging reflex. Direct is simple. As soon as you flash the light in one eye, the pupil should constrict. With indirect, the other eye should be constricting because they are coordinated. بالنسبة للswinging reflex بشرحها لكم. عشان نفهم الابnormal, we want to understand the normal first. فاللي يصير عادة, if you shine a light in one eye, both of the pupils are going to constrict. ليش? Because the signal is going to travel من الretina to the optic nerve to the brainstem, وبعدين the output is coming to both pupil muscles equally. طيب, regardless of how many eyes are getting input, both pupils are going to be affected. فاللي يصير عندنا في RAPD, one optic nerve or the retina, المهم it's going to be a neural cause, the eye is going to send a weaker signal to the brain. Even though ما في شيء, ما عندنا مشكلة بالpupil, it's not going to constrict. فكيف, how do we detect this? أول شيء, you're going to shine light into the healthy eye. So in this case, the right eye. يعني as normal, both pupils should be constricting. Then you're going to swing it to the left eye. طيب, normally it would constrict. لكن in this case, since we have a defect in the left eye, both of the pupils will dilate. طيب ليش? Basically, with the RAPD, من اسمه, it's a relative afferent pupillary defect. Relative meaning when you compare it to the other eye, there's less input reaching the brain. So that's why it's going to dilate. Afferent meaning the input, by the way, اللي هو optic nerve. So when you swing the light into the damaged eye, لأنه the signal is weaker, both pupils are actually going to dilate instead of constricting. مع إنه the light is shining directly on it, the input is weak, therefore it's less is going to reach the brain and you're going to have dilation of the eyes. For when you swing it back to the normal eye, both pupils are going to constrict. For in this case, the pathological eye is going to be the one that causes dilation. So this is also called a Marcus Gunn pupil, and it's going to be a neural issue. زي ما ذكرنا, it's going to be most likely because of optic neuritis or an optic nerve compression, or أحيانا يكون issue retinal, يكون because of detachment. بس عموما you have an issue with the afferent اللي هو the input. فهذا it's a repetition of what I just explained. And you also want to make sure that the patient can properly accommodate. So you're going to hold a close object up to their face and you're going to ask them to focus on it. بالنسبة للexternal ocular examination, you're going to inspect the eye. عندنا صور هنا. You're going to check for ptosis, you're going to check for proptosis, entropion, ectropion, and common lid lesions. عندكم الكليزين, which is اللي هو الكيس الدهني. عندكم ستاي والnodules. We're also going to test the extraocular muscles, اللي هو زي ما اتدربنا عليه بالأوسكي. You're going to ask the patient to move their eyes in an H motion. طيب, this is entropion. You have the lid margin turning inwards. بعدين we have ectropion. It's going to be turning outwards. وبعدين بالنسبة للchalazion or sty, you're going to have some type of lesion over the eyelids. طيب, this is ptosis. قلنا what could cause it? Oculomotor nerve palsy اللي هو cranial nerve 3, or mild ptosis from Horner syndrome. And then a proptosis, as you can see in Graves. Here you're testing the extraocular muscle movement. And this is how you isolate each one to check the movement. طيب, now خلينا نقول we want to check for a squint, okay? اللي هو deviation. أول شيء we have three main tests. عندنا Hirschberg's light reflex. إيش الفكرة؟ When you want to detect a misalignment and you suspect a squint, you need to make sure by shining a light into the patient's eyes and you check the corneal reflection. يعني مو شرط أنا شايفة مثلا المريض قدامي their eyes seem uneven خلاص that's a squint على طول. لا, you need to check because sometimes it could just be because of their head position. فif it's centered, the corneal reflection, that means this is a normal eye. As soon as there is asymmetry, حسب how it's looking, we can classify the different type of squints. هذا أول شيء. ثاني شيء عندنا Krinsky's prism test. So إيش الفكرة هنا؟ إذا دخلت العيادة you'll see like this box, they have prisms with different sizes. الفكرة هنا إنه you're gonna hold a prism in front of the fixating eye اللي هو normal eye, and we want to measure how misaligned the eyes are. Usually بيسووها بالبيديا. ليش؟ لأنه the lazy eye or the eye with the squint is not going to be able to cooperate. فإيش الفكرة هنا؟ You are putting the prism against the normal eye. Once they fixate, this is going to help you measure the angle of deviation. So it's going to determine the power of the prism that you need to center the corneal يعني light reflex. فلما it's centered, that's how you know the deviation angle. بعدين نيجي Bruckner's light reflex اللي هو red reflex. You're checking that it's going to be مثلا it's not overly bright and that it's symmetrical, because this can also indicate some type of deviation. طيب, بالنسبة للسترابيزمس الدكتور ما شرحها, لكن عندنا الcover uncover test. فالفكرة هنا إنه we also want to check for tropia and phoria. فالتروبيا is a manifest strabismus, يكون يعني دائما موجود. Usually you can see it actually. والفوريا is something مو شرط إحنا شايفينه, لكن when we test it بيبان. ليش؟ يكون مثلا over time the brain adapted to it, فما يبان unless we are physically testing it and breaking binocular vision when both eyes are seeing together. فبالنسبة للcover test, you're going to cover one eye and then you're going to watch the other eye. طيب, at this point you're observing this eye. If it shifts upwards to take fixation, معناته إيش عندنا؟ معناته عندنا atropia. طيب, هذه you can see it because it's always there. At this point, you want to uncover the first eye that you covered and you want to watch it. If it moves to refixate, it's going to be called aphoria. This is a latent strabismus, and it's only going to show when you break the binocular vision, which is why we cover the eye. But this is esotropia, this is exotropia, وعندنا hypertropia where it deviates upwards. بالنسبة للanterior segment exam, you want to examine all the structures of the eye from front to back, اللي هي lids, the lacrimal apparatus, the lashes, the conjunctiva, the sclera, the cornea, الiris, والanterior chamber, والlens. طيب, بالنسبة لي السليت لامب it's going to need practice يعني. فبحاول أشرح قد ما أقدر, بس what makes it very powerful بالنسبة لأطباء العيون, you can see things magnified very well. عندكم cobalt blue filter, it's like a setting كذا, there's a button here, you'll change it on. المهم إنه مثلا if I want to see some type of epithelial changes, خلينا نقول someone has a scratch in their cornea, I could add fluorescein to their eyes. وعادة المثل القرنية doesn't ما يمسك الصبغة. فلما يمسك الصبغة, that means I have something wrong with the epithelium. Also, it gives you three-dimensional information, مثلا how deep the anterior chamber is. طيب this is magnification. It's saying that you can use the magnification of the slit lamp to visualize pretty well. هذا برضو تكرار اللي قلته فوق. This is the three-dimensional information. يعني مو بتشوفه بس كذا من قدام. You're able to see the depth of the chambers. وهذا برضو يساعدنا في موضوع الجلاكوما. طيب برضو هنا the doctor mentioned that the cornea is thinner at the center. طيب anterior segment examination. أول شيء you want to examine the lid and the lashes to identify blepharitis. بعدين الكورنيا for keratitis or مثلا opacities or foreign bodies or ulceration of the cornea كذا. He mentioned that contact lens wearers are at risk for it. These are like red flags that could be the beginning of corneal ulcers. فمثلا if your patient's complaining of pain, redness, photophobia, or tears or itching, you have to check for corneal ulcers. برضه زي ما قلنا you can check the depth of the anterior chamber. You could test for uveitis. فهنا الفكرة there are certain findings called cells or flares. الcells كده they're kind of like glimmering light والflares كده it has a smoky appearance. These are signs of inflammation or uveitis. وبرضه you can assess for cataracts. هذه صور للcataracts برضه. الانتراocular pressure measurement هذه قال عليها مهمة لكن ما شرح الأنواع. He was just saying that the gold standard is going to be Goldwyn اللي هو هذا. Essentially you're using this tool, it's going to form a bit of pressure on the cornea and you're going to be able to measure the intraocular pressure. Non-contact فكرته, it's called the air puff tonometer. It's going to release a bit of air, it's going to cause temporary pressure, and you're going to measure the pressure by measuring how fast like the cornea bounces back after the air puff. Indentation تقريبا نفس الفكرة. It's like a weighted instrument and it's going to press down on the cornea and we're going to measure the intraocular pressure. برضو عندكم rebound tonometer اللي هي زي كذا. He also mentioned that hypotony is not common. فاللي هي من higher borderline patients. ليش؟ لأنه الجلاكوما يعني it develops very silently وعادة المريض ما بيحس. طيب الأوفثالموسكوب هذه أعتقد اختبرنا عليه. لا we practiced it for OSCE. المهم this is the device. فكرته إنه it provides magnification and you can visualize all the structures of the fundus of the eye. طيب الفندوسكوبي هذه ممكن تقروها. It's just how to perform the procedure itself. لكن يعني if you do it with the device it's going to be easier. أحسن من إنكم تقروا الكلام. فهنا الفكرة إيش you want to focus on the optic disc اللي هو هذا and the optic cup. عندكم superior nasal arcade is going to be here كذا طالع. superior temporal كذا inferior nasal and inferior temporal and إيش بعد the macula. فإيش الفكرة هنا you just want to observe for all of these structures يعني. برضو عند pathologies to look for زي ما انتم عارفين diabetic retinopathy والretinal detachment atherosclerosis وزي كذا. هذه بالصور he was mentioning this is a picture of diabetic retinopathy. This is retinal detachment زي ما انتم شايفين. وهنا this is glaucoma. والsign اللي خلانا يعني we know that it's glaucoma is that the optic disc is cupping. وبكذا نكون انتهينا من المحاضرة.